So we'll say briefly hello from Auckland, from us, all us guys here. Really delighted to be here. It's a beautiful, warm, hot, sunny day actually here, middle of the day. So it gives us a couple of hours to get out of the sun, and but we're very looking forward to. In fact, half of us biked here. I know bikes around himself, so a few of us have cycled here because it's such a lovely day. But without further ado, we'll pass it back to the rest of the team.
All right, thanks so much.
And the other thing you should probably know is that on EB are people who've turned their health around by going whole food plant-based, and some of them started eating that way after hearing you talk on Radio New Zealand a few years ago at Caldwell. So every time we open our mouths and talk about this stuff, there's going to be somebody who hears some life that's transformed and saved. And so absolutely marvelous to have you here. We've hit 1 o'clock by my computer, so I think we're ready to go if that suits you guys.
Sure. So, my name is Brian Hart. I'm the executive director of the Esselstyn Foundation. Again, we're a nonprofit that seeks to prevent and reverse lifestyle-related diseases through the promotion of whole food plant-based nutrition. And our fearless leader, Dr. Caldwell Esselstyn Jr., is going to speak to you tonight. Dr. Esselstyn received his BA from Yale University and his MD from Western Reserve University here in Cleveland. In 1956, pulling the number 6 oar for the victorious United States rowing team, he was awarded a gold medal. He was trained as a surgeon at the Cleveland Clinic and at St. George's Hospital in London. In 1968, as an Army surgeon in Vietnam, he was awarded the Bronze Star. Dr. Esselstyn has been associated with the Cleveland Clinic here where we live since 1968. And during that time, he's held a number of leadership positions, including president of the staff, member of the board of governors. He also chaired the clinic's breast cancer task force and headed its section of thyroid and parathyroid surgery. He's a fellow of the American College of Cardiology as well. And in 1991, he served as the president of the American Association of Endocrine Surgeons. His publications number over 150. And in 1995, he was able to publish his benchmark long-term nutritional research study in which he demonstrated the ability to not only arrest heart disease, but actually reverse it. Using a plant-based diet. And so tonight you're going to hear all about his research and everything. And Martin, I don't know, or if somebody could spotlight him. Let's see if I have the ability to do that. I think you have to spotlight him. You go up into that, if you go up to his screen and hover over the 3 dots, it should say like spotlight for everyone. Then you'll make him the center of the screen.
There we go.
There you go. Perfect. All right. You want me to pull up you ready for your slides?
Yeah.
Okay.
Well, good evening. And I cannot tell you what a delight and a pleasure it is to be back with New Zealand again. I think somebody mentioned that I had been there a number of years ago. I had visited New Zealand, and I can remember specifically there was a woman from, I think, who was regularly on the radio from, I'm going to guess it was Wellington, but it might have been some other place. And she was commenting that Dr. Esselstyn, if we have, she said, I've looked at your book, and she said, New Zealand makes a lot of its income from sheep and dairy and butter and milk, which they ship all over the world. And she said, if we followed your approach, Dr. Esselstyn, our country would be bankrupt. I said, well, no, I'm going to have to say that I quite honestly, I take take issue with that, because right now the actual foods that you are shipping, the butter and the animal protein, are the very ones that are leading to the #1 killer, both not only in New Zealand and Australia, but throughout the rest of the world. But if you were to give up sending out sheep and butter, you could then start growing plants. You have this wonderful growing season in Australia and New Zealand. And just imagine all the wonderful plants that you could not only consume yourself, but you could mail out and sell to the rest of the world. So that was my introduction to the hospitality at New Zealand. But I'm delighted to be with you, and we got a lot of the ground to cover, so let's get started. Now, we've known for many years that there are multiple cultures on the planet Earth where literally cardiovascular disease is virtually non-existent. For instance, if you were to hang out your cardiac surgery single in Papua Highlands in New Guinea, rural China, Okinawa, the Tarahumara Indians in northern Mexico, Central Africa, forget it. You're not going to find any heart surgery. They don't have heart disease because they're thriving on whole food, plant-based nutrition. Now, this happens to be the oldest slide in my collection, and the reason I show it is to remind me, this was taken when I was leaving Vietnam, having spent a year there as a combat surgeon. And just to remind the audience that when we autopsy those young GIs who have died in combat, 80% of those average 20-year-olds already have gross evidence of coronary artery disease to the heart that you can see without a microscope. Not enough for their cardiac events yet, but there the disease is at that young age already being established. So let's look at another study that looked at it further. This is 1999, looking at this time at young women and men between the ages of 17 and 34 who have died of accidents, homicides, and suicides. And now the disease is ubiquitous, everybody. So those of you in the audience tonight who are over the age of 17, who have been eating a typical Western diet, time to perhaps change your ways because you've already got the disease established. Now, we really had a chance to get it right in World War II. In World War II, when the Axis powers overran the Low Countries of Holland and Belgium and they occupied Denmark and Norway, characteristically, they took away their livestock for their troops. So their cattle, their fish, their pigs, their chickens, their turkeys. Now suddenly we're all gone, and they were thriving on plant-based nutrition in these countries. And it was interesting that in 1951, reporting in England's leading medical journal, The Lancet, what they did was they looked at those who had died in Norway during this period of heart attack and stroke. So let's do this together. Let's start here on the left. And what you see is heart attack, stroke, and deaths of 1927 were going up. 1930 going up. 1935 going up. 1939, in come the Germans. Whoop, down go the deaths from heart attack and stroke. Who recognized that these Germans were these great public health educators? But look what happened in 1945. The death of Adolf Hitler, the cessation of hostilities in the European theater. Back comes the meat, back comes the dairy, back come the strokes, back come the heart attacks. And sadly, we just did not get it. All right. Now here, we have a normal artery on the left, and we have one that's thoroughly diseased on the right. And you're probably saying to yourselves, when that small opening finally closes off, there's going to be a heart attack. Well, actually, no. Maybe about 10% of heart attacks come from something this severe. We'll talk about where the 90% come from shortly. But what happens is, as this disease is progressing slowly, decade after decade, when that small opening finally closes, often the artery will have built its own bypass. That is to say, there'll be these, if you look at an angiogram, and you will see a major artery that's totally blocked, but the patient will still not have had a heart attack. Why? Because as that artery was narrowing down, these small little blood vessels we call collaterals will develop around the blockage, often enough to sustain the downstream heart muscle viability, even when that final opening closes. Now, looking at the normal artery, you can see, even in the back of the room there, inside the artery, a tiny little dark line, one cell layer thick, called the endothelium, which has an enormously important task in what we're going to be talking about tonight. Now, when you start eating the milkshake and the cheeseburger and the pizza, all those cellular elements floating in your bloodstream get sticky, sticky, sticky. And here's a slide from Peter Libby from Harvard. The blue is where the blood is flowing. And notice that what separates the artery wall from the flowing blood is that single layer of endothelial cells that you see here painted purple, all right? Now, again, to make sense of this, let's work together. In the upper left corner, you will see Peter Libby has painted orange your LDL cholesterol molecule. But with the with the free radicals that have come from the pizza and the milkshake and the cheeseburger that you've eaten, those small LDL particles become oxidized by those free radicals. Now they start to wander toward the endothelium. They find a crypt, a crack, a fissure, an opening, and now your LDL cholesterol has found its way into the subendothelial space, where it now becomes fully oxidized. So Peter Libby no longer paints the LDL orange. Now in the left, you can see he starts painting it yellow to indicate that it is a small, hard, dense, oxidized LDL particle. Now the subendothelial space does not like those particles, calls upon the SWAT team, our macrophages, which are blue here, and they come across into the subendothelial space and going from left to right, behave like Pac-Man, gobbling up those small, hard, dense LDL oxidized yellow particles until the macrophage all the way over to the right becomes so absolutely chock full of these LDL particles. We in medicine now change the name of it to a foam cell. Now, the foam cell is truly a Darth Vader of this event. Why? Because the foam cell makes or manufactures, elaborates these nasty metalloproteinases, strelsin, elastase, collagenase, and myeloperoxidase. What do they do that's so bad? What they do is they tend to progressively thin out the cap over the plaque. So let's go to the figure on the left here. And if you look at the cap over the plaque at the upper portion, that suddenly you can see it's a little bit torn. Now, this is an absolutely seminal moment. You have torn the cap over the plaque. You have ruptured it. So now there is going to be what we call the extravasation of, or the oozing out of, if you will, of plaque content into the flowing blood, which tends to activate our clotting factors. So we go from the figure on the left to the figure in the middle, and where the plaque is ruptured, there's the formation of a clot. And the clot is in and of itself self-propagating. So in a matter of further minutes, we go from a plaque which was just ruptured on the figure on the right, it is now suddenly 100% blocked with this clot. All the downstream heart muscle has now completely lost all of its oxygen and nutrients as it starts to die, and that's 90% of your heart attacks. However, if I do my job correctly this evening, hopefully every one of you, and maybe even your friends and relatives, can learn to make themselves heart attack proof. How are we going to do that? How are you going to make yourself heart attack proof? We're going to make it happen by changing your biochemistry. How are we going to do that? Well, we're not going to do it with drugs, stents, or bypasses. We're going to change your biochemistry with food, whole food, plant-based nutrition without oil. When that happens, what we do is we interrupt that entire sequence of events that I've just shared with you. There will be no oxidation of your LDL cholesterol. It will not migrate into the subendothelial space. There will not be the appearance of the macrophage, and there will be no foam cell. without any foam cell, then the cap over your plaque will begin to strengthen. As you strengthen the cap over your plaque, it cannot rupture. If you cannot rupture your plaque, you have made yourself heart attack proof. Pretty exciting stuff. Yeah. Now, you can forget the x-ray here, but I want you to just focus where the artist has drawn for this artery opening. And if you look, you'll see that half of it is filled with a plaque and the other half is still open. And the other half that is open, you can see that it is lined with these lovely little, they're white cells here, but they actually are the endothelial cells. Now, up until about 1980, we used to think of the endothelial cells as these cute little red bricks that were lining these wonderful vascular pipes of ours. But that all changed in 1980 when Dr. Furchtgott, working in his lab in Brooklyn, was taking the largest blood vessel, the aorta, from the rat, and then he would do this sort of spiral staircase elliptical cut on the aorta of the rat, right through the endothelium. Then he would immerse it in a bath of saline, and it would squeeze, it would constrict. But one day he decided to do it with no cut on the aorta, no injury to the endothelium. Excuse me. Gonna take a little to help. No cut on the endothelium. He immersed it and it dilated. So suddenly now the race was on globally. What was the EDRF that Dr. Furchtgott had discovered? Now, thank heavens that term was with us only 8 years, because at the end of 8 years, Dr. Furchtgott, Felix Murad, and Lou Ignarro, those three scientists discovered that the EDRF was a gas. And it was called nitric oxide. And it was interesting that 10 years later in 1998, those three men received the Nobel Prize for discovering nitric oxide. Why? What was it that was so exciting about nitric oxide that made it worthy of a Nobel Prize? Well, let's look at the functions. One, nitric oxide will keep all the cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide can protect the wall of the artery from becoming thick and stiff or inflamed and protect us from getting high blood pressure or hypertension. Number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from developing blockages or plaques. So literally, everybody on the planet Earth who has cardiovascular disease has their disease because in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news is this is not a malignancy. It is a completely benign foodborne illness. And once you can get patients to understand that never, never, ever, ever again are they to eat anything that is going to further injure an already train-wrecked endothelium, because then the endothelium can recover, make enough nitric oxide so we can halt disease progression, and we often will see elements of disease reversal. Pretty exciting stuff. Now, usually at this point, if I'm in a live audience, I look out and I can see the members of the audience saying to themselves, gee whiz, I kind of wonder what my level of nitric oxide is. Well, we don't really have a good way in the doctor's office to measure that. However, what is done from a research-based standpoint is something as simple as this. You take an ultrasound probe and you place it over the brachial artery at your elbow, and there you get a readout of the diameter of the brachial artery. Then for 5 minutes, you will encircle the upper arm and inflate the cuff until it's above systolic blood pressure, so that for 5 minutes, you have zero blood flow to your forearm and hand. Yes, I've had it done, and no, it's not habit forming. Anyway, then you release the cuff and immediately remeasure with the ultrasound probe the diameter of the brachial artery at the elbow. In the normal individual, it'll be 30% greater diameter because of the outpouring of nitric oxide while the tourniquet was in place. Now, the other interesting study that came about with this was Dr. Vogel, who was chairman of cardiology at the University of Maryland, took a group of healthy young subjects to a fast food restaurant that is characterized by arches, which are golden. Half of them had cornflakes, the brachial artery tourniquet test, and the half normal. The other half had the hash browns and sausage. 120 minutes after the group ate the hash browns and sausage, they could not dilate the artery. That single meal so injured the capacity of their endothelial cells to make nitric oxide, they could not dilate their artery. However, being young, as they waited on into the late afternoon and evening, they began to recover. But you and I know that the next morning for breakfast, it'll probably be scrambled eggs and bacon. Now, about lunchtime, it'll be cold cuts with white bread and mayonnaise. And at supper time, it'll be baked potato with sour cream, lamb chops, vegetables soaked in butter, ranch dressing on a salad, and ice cream for dessert. So here in the good old USA, and probably in New Zealand as well, and Australia, we start in our childhood injuring and injuring and injuring the endothelial cells. All right. Well, now let's just have a sort of a little review here of the functions of nitric oxide. It prevents stickiness, the strongest vasodilator. It avoids arterial thickening. It prevents blockages. It prevents smooth muscle migration into the wall of the artery, and it destroys Darth Vader, the foam cell. Now, in this next slide, you're going to see 5 very strong defense mechanisms that the body has. Now, we're kind of limited in time today, so we're going to focus largely on the most important one at the top, the endothelial cell. But know this, every single one of these 5 is absolutely optimized when you are eating whole food, plant-based nutrition. So this first study that I got involved in back in 1985, the study was small because I was still under obligation for my surgical responsibilities. 23 men, we had nothing against women. It's just the way the patients were sent. And they all had severe triple vessel disease. Now, the thing we wanted to absolutely have them avoid are the foods that injure endothelial cells. So, most important, not a drop of oil. Olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil. No oil. No animal protein, meat, fish, chicken, fowl, turkey, and eggs. I don't like dairy, milk, cream, butter, cheese, ice cream, and yogurt, or caffeinated coffee. Decaf is fine. Caffeinated coffee will injure endothelial cells. And I'm not a great fan for nuts as well. We want to eliminate all that saturated fat. Okay, now, here, for those of you who are a little bit nervous about what I just said about oil, here is a peer-reviewed scientific article. Olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Now, I just want to take a moment and share with you a little bit of research by Stanley Hazen from our institution. And Stan was looking at these products, these animal products that are eaten by omnivores. And he was testing to see if omnivores have bacteria in their gut, in their microbiome, have bacteria that will metabolize lecithin and carnitine to TMA, trimethylamine, which is rapidly oxidized in your liver, by your liver, to TMAO, trimethylamine oxide. And what is the nasty thing about trimethylamine oxide is it can injure blood vessels. For example, here was just lecithin and carnitine on the left. It gets into the gut where the bacteria of an omnivore converts it to TMAO, trimethylamine oxide, which then produces vascular disease. But the interesting thing about Stanley Hazen's research is when he took persons who were totally plant-based, gave them a lamb chop, measured their blood for TMAO, not there. Why? Because apparently people who are totally plant-based do not possess the bacteria in their microbiome that will convert lecithin and carnitine to TMAO. So another very powerful reason to be plant-based, because otherwise, every time you're eating the animal foods, you're absolutely undoing your blood vessel health. All right, this is the one slide in the presentation that has nothing to do with cardiovascular disease, but I put it in because it was such an important historical moment in 2015 when the World Health Organization, think of it, individuals from throughout the globe coming together and meeting and agreeing agreeing to the science that the eating of red meat and processed meat has the same level of carcinogenicity as smoking cigarettes. All right. Now, what do you want these people, what do they eat? All these marvelous whole grains for their cereal, bread, pasta, rolls, and bagels, 101 different types of legumes and lentils, all these marvelous red, yellow, and green leafy vegetables, and some fruit. Now, I want to take a moment and divert again, just to show you how how my program changed about a decade ago. About 10 years ago, we made a change. And it was based pretty much on the fact that the endothelial production of nitric oxide is age dependent, all right? Age dependent. You never heard, for instance, of an 8-year-old boy or girl having a heart attack. No. They have nitric oxide coming out of their ears, but by the time they're beautifully healthy at age 50, they now have 50% of the nitric oxide they had when they were age 25. And by the time you're 80, you've lost 70%. So the changes I made were two. One, a greater stimulation of the endothelial production of nitric oxide. And number two, we embraced the newer research that shows us that mankind has an alternate pathway for making additional nitric oxide. So here we go. I need my patients with demonstrated heart disease to, they have to consume 6 times a day a green leafy vegetable, roughly the size of 1/3 of a cup after it has first been steamed or boiled 5.5 to 6 minutes so it's nice and tender. Then you must anoint it with several drops of a delightful either balsamic or rice vinegar, several drops. Why? Because research has shown us that the acetic acid from those vinegars can restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your luncheon sandwich. That's 3 Mid-afternoon for dinner time, 5, and of course I adore it when you have that evening snack of arugula or kale. All right. Now, the second benefit from chewing the green leafy vegetable. When you're chewing the green leafy vegetable, you restore the capacity of the bone marrow to once again make the endothelial progenitor cell. What do? They replace our senescent, injured, worn-out endothelial cells. Now, the third benefit. When you're chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce the nitrate that you've been chewing to a nitrite. And when you swallow the nitrite, it is now your own gastric acid, which is going to further reduce the nitrite to more nitric oxide, which can enter your nitric oxide pool. So think about it. What you're doing with minimal expense, right? No side effects, all day long, dawn to dusk, morning to night, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there is a caveat to this, and that is that toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria in your mouth. And I do not like antacids because antacids will decrease your gastric acidity and you will be unable to reduce the nitrite to more nitric oxide. Now, the top 6 vegetables would be kale, Swiss chard, spinach, arugula, beet greens, and beets. On the other hand, if you want the entire list, it goes bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard greens, turnip greens, snappy cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, arugula, and asparagus. And the reason I go through it like that for you is you have to know how whole food plant-based nutrition is so good for your memory. All right. Now, no oil. I want to show you now several angiograms of patients who had what we call disease reversal. And these angiograms were all reviewed in triplicate in the Cleveland Clinic Angiography Core Laboratory. So when I give you a percentage of reversal, I know that it's accurate. You're looking now at a 67-year-old retired pediatrician, and you're looking from the arrow on the left to the arrow on the right. That was described as a 10% improvement, which is about as small as your naked eye can see. However, easier on the next one. This is a circumflex artery to the back of the heart in a 58-year-old factory worker. And from the arrow on the left to the arrow on the right, that was described as a 20% improvement. Now, wait. Here we go. Now, this is the right coronary artery in a 54-year-old retired security guard. And from the arrow on the left to the arrow on the right was described as a 30% improvement. Now, this is Dr. Joe Crow, a surgical colleague and friend of mine who in 1996, at age 44, began to get chest pain. And he was not diabetic. He was not hypertensive. He was not a smoker. He exercised regularly. There was no family history. He was not overweight. And in October of 1996, they finally, cardiology worked him up, but they could find nothing wrong. A month later, he finished his surgical schedule, sat down to write post-operative orders when suddenly the elephant was sitting on his chest. Pain in his left jaw, left shoulder, left arm. He was having a heart attack. He was whipped down to the catheterization laboratory. They start the catheterization, cardiac arrest, resuscitate. And they had one more cardiac arrest, finish the catheterization. and then is sent up to the floors, but he's stable. And 4 days later, he's able to be discharged. However, when discharged, he was very depressed. And the reason he was so depressed was that at the time of his angiogram, you can see that the entire lower 1/3 of the left anterior descending was all moth-eaten and diseased over too long a segment to just try to pound in stent after stent, too far down the artery to consider bypass surgery. So he was sort of depressed about this. And so that my wife and I had Joe and his wife out for dinner 2 weeks after his heart attack. Joe, come on, look, you've been eating this terrible Western diet. You got the typical Western disease. Why don't you think about going plant-based? We've got 10 years of data and experience. And he said, well, yes, I'll give it a shot. They really couldn't offer me anything else, but I'm not going to take any of those statin drugs. I hear there's too many side effects. It's fine. I said, that's your call. No problem. Joe Crow became the absolute personification of commitment to whole food plant-based nutrition. And over the next 2.5 years, his total cholesterol plummeted and his LDL went from 98 down to 38. And then 2.5 years after his heart attack, he had another catheterization and an angiogram. And on the day that I knew that earlier that morning, Joe had had his follow-up angiogram, at noontime, I wandered over to his office, let myself in, and there he was sitting behind the desk. Joe, I said, do you mind sharing with me how did the follow-up angiogram grow? And he said, got up from his desk, came around, put his arms around me and said, I think we're doing okay. And I said, well, that's fine. But any chance that I could see the angiogram? He said, oh, yeah. Now, that's not going to happen every time. But when the plaque is young and soft and made up of inflammation, fat, and cholesterol, and the patient is absolutely doing it as it should be done, it's now this is not going to happen with everybody, because there are going to be some patients in their late 60s and 70s where this plaque has been there for decades and it's made up of scar and fibrosis and calcification. However, as it's going to be my responsibility to share with you tonight how those patients just as well can get back to full activity of daily living. Now, this is actually a 45-year-old gentleman from Florida who on July 14th of 2017, he had a heart attack. And you can see the angiograms that he's sent to me shows that this arrow is pointing to an 80% blockage, but he had multiple other blockages, which led his cardiologist to tell him that he should have bypass surgery. He wasn't keen on that. And he said, no, I'm going to read this book, Prevent and Reverse Heart Disease, and see if I can do it with diet. Well, the very next year, the cardiologist was still nervous about this because he told the patient it never would work. And they got another angiogram, and what was 80% blocked on the first one we just saw was now 40% blocked. And at this point, there was a change in cardiologists, and 1.5 years later, his new cardiologist wanted to get another picture of that, and bingo, it was all gone. The reason I got these films was that the patient wrote a letter to me and included the films thanking me for the writing the book. But let's just pause here for a moment. When you look at what happened here, this poor fellow never had a single doctor who offered him the option of plant-based nutrition without reading the book. It is safe. It is inexpensive. There's no additional cost. You got to eat. And it is powerful, prompt, and enduring. And really, it comes to the point where you really have to ask yourself, why is it that every patient with cardiovascular disease who is stable and doesn't need some emergency should at least be informed of this approach as an option? And also, obviously, if we get the public to eat this way, we would end the epidemic. All right. Now, let's go back to that original group of the original 24. There were 24 patients originally, remember? There were 6 fellows, nice guys, but they just had no idea what we were trying to do. We had no money for this. So I released him full-time to their expert cardiologists, and they became my sort of control group. However, the 18 that stayed with us beyond 12 years, I wanted to know how many coronary events of disease progression they had experienced in the 8 years prior to coming into our study while they were in the hands of expert cardiologists. And as you can see here, in the 8 years prior to coming to see us, these 18 patients had 49 coronary events of disease progression. However, once they came into our study over the next 12 years, 17 of the patients had no further progression of disease. There was one little sheep who wandered from the flock, got into the wrong foods, but everybody else stayed with it, and their disease was vanquished. Now, as delighted and as happy and excited as I was about that ability to absolutely halt and reverse disease, not everybody was that excited. Dr. Esselstyn, this is a small study. Dr. Esselstyn, this study was never randomized. Dr. Esselstyn, what makes you think you could ever do this with a larger group? So we did. Now, what I want you to notice here, particularly, because many times physicians will say that our approach is severe, strict, or extreme, whereas I would say that the severe, strict, and extreme applies to the typical Western diet eaten in the United States, Australia, and New Zealand that guarantees that they've got this epidemic of disease. But look at here. Of the 198 patients in this study, 2 were lost to follow-up. 177, or 89.3, almost 90% were adherent to our program. Non-adherent, there were 21. Now, of those 177 who were adherent, how do you get patients to change their lifestyle? The most important thing of all, you must show a patient respect. And the only way that I know to show a patient respect is to give them our time. So in the present format that we have, it's not that you talk to the doctor for 10 minutes and he gives you a pill. Our present seminar for these patients is 5.5 to 6 hours, one day. And I insist that my secretary give me everybody's phone number so that 2 weeks before they come to the seminar, I have an opportunity to call them myself, where I can get my arms totally around their story, and at the same time provide them with an opportunity to ask questions of me so that coming to the seminar, we have a strong platform from which we can all move forward. And I want to say another further word about how important it is to share with the patient the causation of the illness. And by that, I hope many of you by now understand that the causation of the illness is when you have so trashed the ability of your endothelial cells to make nitric oxide, you don't have enough nitric oxide to protect you any longer. So after 5 hours of this, plus my phone call beforehand, anybody with a brain in their head understands that they have their heart disease because they have so trashed the ability of their endothelial cells to make nitric oxide. So the reason I think we're close to 90%, anybody with a brain in their head is not going to come up to me and say, Dr. Esselstyn, that was very interesting, but Lois and I are going to celebrate our 35th wedding anniversary next week, and I guess that's been when I'll be destroying a few more of my endothelial cells. What? No, nonsense. No, it really helps when you give them the time and have them put the science in a format that they can understand. All right, how did they do? Well, of the 177 that we were adherent, there was one who actually was not adherent. When he on vacation, he went to China and ate off the economy and just ate terribly. He had a small cerebellar stroke, but he proves the point that I was trying to make. And really, if you take out him, who totally strayed, and that everybody who adhered had no progression of events. But I guess we were afraid to do that because nobody would believe 100%. The 21 patients who were non-adherent, 62% had disease progression. Now, I wanted to compare our results with some of the better known studies here in the West on disease. And let's start with the box on the right. That is, you see the name underneath, the Lyon Diet Heart Study. At the end of 4 years, 25% or 1/4 had a heart attack, stroke, or death. Let's go to the left, the next box. Natural history of coronary disease from Columbia Presbyterian Hospital in New York City. At the end of 4 years, 20.4% heart attack, stroke, and death. Let's go to the left one more time. The Courage study by Bill Bowens, 19% heart attack, stroke, and death. Now go to the left, and there we are. Treat TTC, treat the cause. 0.6%, that one patient. That's a 30-fold different from all the others. And what's the difference? The difference is that we absolutely insist on having the patient understand the causation of the illness. Sadly, today in cardiovascular medicine, all that is used is drugs, stents, and bypass surgery, none of which has a single item to do with the causation of the illness. All right. So in summary, no mortality with the diet, no morbidity with the diet, no increase no increased expense for eating because you got to eat, and the benefits improve with time. And when you think about it, today, almost every patient who has had a heart attack is sadly walking around wondering with the sword of Damocles hanging over their head, when do I get my next heart attack? Well, nonsense. How exciting and empowered they can be when they recognize that they themselves can be the locus of control to halt any disease progression. Now, here you see on the left, the pulse volume at the right ankle of a patient who had heart disease who came to see us, and he had to stop 5 times crossing the skyway to my office because of pain in his right calf muscle. And I totally forgot about his leg. I was so focused on his heart that after he'd been with us about 10 months, and he said, Dr. Esselstyn, do you recall when I first started seeing you, I had to stop 5 times crossing the skyway to the bridge? You know, he said, this last month or so, it's gotten, so this pain is gone. Don, back you go to the vascular lab. And on the right, when they repeated it after 10 months, his pulse volume was now double. This absolutely gave us a tremendous amount of excitement. We now had absolutely irrefutable, rock-solid science that food and food alone had absolutely reversed cardiovascular disease. And somebody's going to say something about, well, what about what about statin drugs? Well, wait a minute. This was 1986. There were no statin drugs. Okay. Here is another. This is a 78-year-old retired high school chemistry teacher, and he and his wife in their retirement loved to enter square dance contests. But it was doing the fast square dance that he got bilateral calf pain. So he saw some vascular surgeons who got the images you see here, and he was not very enamored of the magnitude of the operation that they were proposing he could have. So he came to see us and said, Dr. Esselstyn, if I choose your method, how long will it take me to get rid of my calf pain? So I looked at him with great wisdom in my face, and I said, probably about 8 or 10 months. 3 months later, I got a phone call. Dr. Esselstyn, you do not speak the truth. The pain is gone. Now, I can't recall what it's like in New Zealand, but here in the States, when you're watching on television, either a mystery or a athletic contest, just before the advertisement comes on, you will hear the mellifluous tones of the announcer say something like, "When the moment is right, will you be ready?" Now, we all know that the penile artery is smaller than the coronary artery, so not infrequently, before somebody comes down with heart disease, they may notice that they are no longer able to raise the flag. However, all is not lost. Not occasionally. I'll get a phone call after 10 or 12 months after I've seen somebody. "Dr. Esselstyn, yes, this is Mr. So-and-so. Good, nice to hear your voice. Yeah, doc, thought I ought to give you a call because recently something has come up and I'm wondering if I don't owe you another check." All right. Now, winding it up, before we get some questions perhaps, but this happens to be on the left a PET scan, a PET rubidium dipyridamole scan. By that, I mean, if it is orange or yellow, that's a good blood supply. But as you can see on the left, the figure on the left, there's a patch on the lower right where it's all green. There is no yellow. That's what we call ischemia, poor blood supply. So I counseled him at that time. And then he came back. Let's see, his cholesterol dropped in 10 days from 248 to 137. Then he came back 3 weeks later and had another PET scan. Bingo. It was now all reperfused. Pretty exciting stuff. Pretty exciting. But how in the world do you ever get rid of a blockage or a plaque within 3 weeks? Something else was going on. So I called to Rodriguez, and he happens to be chairman of the cardiovascular pathology at the Cleveland Clinic, who dissects perhaps 200 hearts a year from the deceased. And what you're looking at here are the three main coronary arteries, the right coronary artery, the left anterior descending, and the circumflex. And look where they all go. They get all the publicity when they're riding on the surface of the heart, stents, bypasses, and so forth. But where do they all go? They all dive, D-I-V-E, they dive into the heart muscle to nourish this muscle, which never gets a rest, never gets to stop. So looking at this particular figure, you can see the thousands upon thousands of interlacing intramuscular coronary arteries. And I asked Rodriguez, I said, how often do you ever see blockages or plaque in these intramuscular arteries once the artery has dived into the muscle? His answer, never. Well, now I had the answer. Why was it that so often we see a patient with angina with effort? Let's suppose walking 2 blocks, they begin to get chest pain and angina. And they start eating this way, and suddenly they find they can go 4 to 6 blocks before they get any pain. And after that, it's 8 or 10 blocks. So really what is happening is that there's a tremendous improvement. Now, how does this play out? When I first see these patients, their endothelial cells are so beaten up, they're barely making any nitric oxide, the strongest blood vessel dilator. Also, the endothelial cells have become your enemy. When they're so beaten up, they now are making 2 molecules, endothelin and thromboxane, which are vasoconstrictors. And these vasoconstrictors obviously are narrowing the blood supply to the heart muscle. So when you look at this heart, this diagram, and you see all those tiny little vessels, think of them all being pinched or narrowed, not with a blockage, but they're just pinched or narrowed because of the molecules of endothelin and thromboxane. And what happens so not wonderfully and so rapidly, when they stop eating any of those foods that are continuing to injure their vessel, they start eating whole food plant-based nutrition. Immediately begins to come back nitric oxide, the strongest blood vessel dilator, and at the same time, you're vanquishing endothelin and thromboxane. They no longer are pinching these vessels. all these little vessels now are dilating. And if you recall, Poiseuille's law of flow through the hollow viscus is related to the fourth power of the radius. Translation, tiny increase in diameter, huge increase in flow. So here these patients are with an enormous sudden increase in flow that happens, as you can see, within 3 weeks. So let's summarize. How do you see reversal of this disease? You can see it on an angiogram, a stress test, PET scan, and you see it in the carotid artery, reverses in the leg, and it reverses with the symptoms of angina, claudication, and erectile dysfunction. For those of you who don't know, I'm going to share with you, this is the so-called A building at the Cleveland Clinic, where I worked for many years on the 8th floor as a surgeon. But you know, you might want to know what the trees look like here in February. However, after I retired from surgery, I was hired in the Wellness Institute because of my interest in reversing heart disease. And that was a little bit of a change. The budget was more modest, but the morale was really quite high. And one thing I've learned in 62 years since leaving medical school, yes, brains are important, but nothing is important as persistence, 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 best exemplified by this young damsel in Life magazine, 1939, trying and trying and trying to learn how to do the splits, but it was tough. However, the other day in downtown, I believe it was Wellington, somebody spotted her and she had got it right. Martin, let me say that I appreciate the patience of your audience. And if you've got any questions, I'll be delighted to try.
Yeah, I think either Catherine or Renee will handle questions. Yes, and that was an absolutely marvelous talk, taking us on a lovely story on how heart disease develops and what we can do to reverse it. And although, you know, when people have trashed their arteries, they've done all of this unknowingly, and that's the horrible thing. So, guys, if we can get questions from people, that would be great. Thank you.
Looks like Jackie has a question. She says in the chat, if you want to put your questions in the chat, that'd be great. Jackie says she observes when she cuts herself, it takes a while for her blood to clot. Her GP says that it's what's called an oozer. It's quite common for plant-based eaters. Is it quite common for plant-based eaters as a result of higher NO?
I've not seen that be a factor, no.
Yeah, probably not.
Yeah, hi. Just let me know. Can you hear me okay?
Yeah.
Dennis. Yeah, Dennis Wood from the Auckland pod. I've been on a plant-based diet for about 2.5 years, and I had a CIMT, which is the scan of your carotid artery for those listening, about 2 years ago. And I've always been curious to be able to sort of benchmark the progress I'm making and to be able to tell the doubters that I told you so. How long would you leave it to I have another scan?
You know, it's hard to give a hard answer to that because we have such a tremendous variation in individuals and also a variation to the degree of compliance that they are adhering to. But no question that we do see a reversal of disease of the heart. We see it in reversal of disease of the leg. We see it in reversal of the carotid artery. And if you wanted to get, the nice thing about the carotid artery, you can chart the progress without having radiation just by simply getting an echo study. And the echo study, you can do that perhaps even every 6 or 12 months. And you can chart the progress that way. But just be sure that you're getting enough nitric oxide on board. And that's the whole reason for emphasizing the green leafy vegetable. Because every time you are eating the green leafy vegetable, remember I've shared with you the entire mechanism, how that's produced.
Thank you.
Someone says, Let's see, we've got some questions here. Can you please tell us a little bit about the fluoride issue?
Well, toothpaste with fluoride, public drinking water with fluoride, and mouthwash will injure the beneficial bacteria of your mouth. And the person who enlightened us to that, I think, would be Nathan Bryan, who is actually from Texas. And apparently, fluoride will somehow compromise the bacteria in your mouth, and then, of course, then there goes your conversion to nitric oxide. It's gone.
All right, someone has a question about do you have to eat grains?
Grains?
Yeah, like I don't eat grains. Do you have to eat grains?
What does she eat instead of grains?
She's been plant-based for 20 years, but she had a pacemaker inserted 3 years ago. I don't eat grains, though. I can't digest them. How much does a plant-based diet need to have grains, and which ones are best?
Well, it's another wonderful source of carbohydrate and protein and some fat. And really, grains are generally pretty darn healthy. Does she react adversely to them?
Yeah, it sounds like she can't eat them.
All right.
Can't digest them.
Well, then I would suggest they go to the. There are a couple of books that are my daughter and my wife had written. But the Prevent and Reverse Heart Disease book that I wrote has 140 recipes, another 140 in the Prevent and Reverse Heart Disease cookbook, another 140 in the Be a Plant-Based Woman Warrior. And I think if you go through those books, you'll find some presentations without grain.
Someone's saying thanks so much for they saw you back when you presented at Ridge Park and Rotorua, Tui Ridge Park. Sorry. My mother had heart failure 2 years ago. Is heart failure reversible?
Yeah, you have to kind of see if you can't figure out what is causing the heart failure. Is it hypertension? Is it obesity? Is there a valve problem? Is there extensive problem with the blood vessels supplying oxygen and nutrients to the heart? So heart failure, or it might just be a very infrequent viral infection, which will adversely affect the heart. And sometimes there can be a form of amyloidosis, which can actually infiltrate the heart muscle. So the whole key in heart failure is to have an absolutely rock solid diagnosis so you can go after the causation.
Does PCI reduce the risk of major cardiac events in those patients who have had NSTEMI?
I think that I just saw a lovely review in an American Journal of the American College of Cardiology, and they, with all due respect, stents compared to more aggressive approaches such as stents and bypass there's no benefit from a standpoint of mortality.
So stents and bypasses don't increase lifespan.
Compared to aggressive lifestyle change. Yeah. That was actually 2 weeks ago that it came out.
Someone had a question about their nails, feeling like as if their nails are less connected to the skin. Anything you should think about that?
I've heard that off and on for probably 35 years, but I know there's no science behind it. Yeah.
Interesting. How about I'll ask some questions that always come up that people are always interested in. What do you think about alcohol?
Well, alcohol is a toxin. It's toxic to the brain. It's toxic to your heart. It's toxic to your liver. And so it's really, it used to be that there are a number of physicians who carefully studied this, and it was always felt that maybe a modest amount of this would protect your arteries from heart disease. That's absolutely, totally bunk. And apparently now, if you're really hard-nosed about it, the ideal amount of alcohol to eat is 0. But since I'm such a fun-loving guy. Maybe once a week, maybe a small glass of wine. That's okay.
Carl has another question about micro or the oral biome. Is chewing gum? What do you think about chewing gum? Can that damage endothelial function?
Not that I'm aware of.
Not that we're aware of. Interesting.
Yeah.
Have you seen any reverse
Atherosclerosis?
No, it's not atherosclerosis. It's athlavescelosis, who has LPA.
I think
small
well,
a.
let's suppose that they mean atherosclerosis. Yeah, LP small a obviously has been around for many decades, but it just in the last 10, 15 years has gotten a lot more publicity, and people can kind of think of it as a form of your bad cholesterol. But I have a thought on this, and that is, you have to bear with me on this one a little bit, because the experts now estimate that almost all cultures will have 20 or 25% of their inhabitants will have an elevated LP small a. All right. So let's just think back historically for a minute. That would mean that rural China, Papua Highlands and New Guinea, Okinawa, Central Africa, the Tarahumara Indians in northern Mexico, who never have heart disease, despite the fact they've got 25% of the group has an elevated LP small a. Another way to look at that is that since they're all eating in such a favorable manner, they are making what I would call an endothelial fortress. That is to say, even if you've got a few molecules of LP small a or LDL or going through your bloodstream, it cannot attack and injure your endothelial cells because of the diet that you're eating is so anti-inflammatory. All right. The other way to look at it, the study that I shared with you of some 200 patients, when you think about it, of those 200 patients, remember, we're close to 4 years of follow-up, no disease progression in those who are adherent to our diet. Well, what this is telling us is that in patients may have a small LP small a, but it's not going to be able to injure you if you are strictly adhering to whole food plant-based nutrition.
Someone has a question about caffeine. Can you elaborate on caffeine and its damaging of endothelial cells?
Yeah, I'm not sure it's the caffeine that's doing the damaging. It may just be somehow the combination of the caffeine and the coffee, because the study I'm quoting that tipped me off to this is an Italian study, and they simply took two groups of healthy young subjects. Half of them got coffee with caffeine. The other half got decaf. After they drank the beverage, they did the brachial artery tourniquet test for endothelial function. Then they switched groups. The group that previously was having decaf was now having coffee with caffeine. It was always the group having coffee with caffeine which injured the endothelial production of nitric oxide. Now, so that doesn't tell us that it's caffeine. It does tell us that it's caffeine with coffee, because I don't see a problem with black tea or green tea.
Yeah. There are over 100 different kinds of chemicals in coffee. I read that recently. Yeah. All right. Any other questions?
Yeah, I've got a question. Can you hear me?
Yep.
Hello. Hi, my name's Grant Dixon. Caldwell, you changed my life. I would be dead now if I hadn't read your book. And that came out of the Radio New Zealand chat that you gave here in New Zealand. I heard it a year later, actually, they repeated it. And there's a number of people here in New Zealand whose lives have been changed because of that chat or because of that interview on the radio. So thank you very much. I've since made a documentary about my life. It's called The Big Fat Lie. It's shown internationally all around the world. And I credit you in that documentary too. So thank you. I have a question though, and that is, since you wrote the book, it's about 2009 or sometime around there, the original book. Is there anything significant that has changed since then, since you wrote the book? You alluded to something in your talk earlier on, but is there anything else?
Oh, yeah. No. Yeah, I didn't. The book does not contain anything that I was fairly extensive about that this evening. And that is about the whole business about the green leafy vegetables, because as I became more and more overwhelmed with the importance of nitric oxide, it was so exciting to find that there is this alternate pathway of chewing the green leafy vegetables. Now, the reason I have people do it 6 times a day is because, see, the reason my program succeeds where others fail, nobody else is as mean as I am. In other words, I hate failure. So this is why it's a matter of detail. And if patients can understand the causation, that the injury to the endothelial cell destroys your nitric oxide, you lose your nitric oxide, you lose your vascular protection.
Thank you.
But I think the stuff about fluoride's new. That's pretty new.
Oh yeah, the fluoride. That's the
fluoride piece.
That was, I sort of included that when I talked about.
Yeah, and people often ask, another thing I'll prompt Dr. Esselstyn with is, what kind of supplements do you take?
Yeah, I think you can check. I think everybody should take the B12. You don't want to get deficient in B12. And as we get more senior, the reason that the dose goes up from 500 micrograms to maybe 1,000 over 70 is the fact that as we get more senior, we have less gastric acidity and less intrinsic factor, both of which are in the stomach and important for the absorption of B12. Probably also important to check your D. And you want to keep that somewhere above the normal, depending on what the normal level is in your community. But it's probably good to check the vitamin D. Those two would be sort of the essentials that I would think about. If you want to go further, you could always think about checking omega-3. Maybe the science isn't quite complete on that yet, but it doesn't seem to hurt at all. You can check your vitamin D level, excuse me. You can check your omega-3 levels, and you'll either be normal, borderline, or low. And if you're borderline or low, you can simply supplement with something like omega-3 algae.
Someone's asking, would eating raw kale rather than cooked 6 times a day affect?
Right. I'm pretty well convinced that you could probably do just as well on raw, but there is some literature that suggests that when you heat or cook, you break down some of that cell membrane so that when you chew it, you even have more access to these vital nutrients.
And then balsamic vinegar actually enhances that, right?
And yeah, what balsamic and rice vinegar have been shown to enhance is the ability of your nitric oxide synthase enzyme to make more nitric oxide.
Excellent.
So you're responsible for me beginning my whole food plant-based journey. I have a couple of questions or doubts. You seem to be at the most extreme end of all the advocates of plant-based nutrition. And in particular, how do you manage to eat leafy greens 6 times a day? I've tried several times and never got anything near 6 times a day. And if you're eating that, what else do you eat for the day? So that's one point. And the other thing is, people like Michael Greger will say, well, you need some fat as a transport for your fat-soluble vitamins.
Right.
So, yeah.
Yeah, and you're not, because you want the wonderful thing about the fat. There's fat in grain, there's fat in legumes, there's fat in lentils, there's fat in red green leafy vegetables, there's fat in potatoes. And really, you're not ever going to be fat deficient from that standpoint. as far as comparing my business with being what we call severe, strict, or extreme, as I said earlier, I think those terms really apply to those who want to eat the typical Western diet, because that's the one that gives you heart disease. That's the one that gives you diabetes. That's the one that gives you hypertension, high blood pressure. That's the one that gives you strokes. That's the one that gives you vascular dementia. It's also the one that gives you Crohn's disease and ulcerative colitis, rheumatoid arthritis, lupus, and multiple sclerosis, allergies, and asthma. And the list goes on. So when you're eating this way, you're additionally protected from all those additional conditions besides heart disease. As far as I would not be a little bit kinder to yourself and maybe cut back to the 6 to something that you can accommodate and make a smaller portion, maybe 3 or 4 times a day, and that'll probably put you on a because remember this. Back in 1985, when I started, we had no concept about nitric oxide, but still those patients were doing beautifully. It was exciting.
Yeah, to your point, you raise a great point, and we actually have 2 terms that we use. There's plant strong and plant perfect. And so Dr. Esselstyn would be considered an advocate of a plant perfect diet. And remember, a great deal of his experience has been working with people who have advanced heart disease, multiple stents, numerous bypasses. So he really needs his patients to be as strict as possible. No nuts, no avocado, because those people will, they start eating nuts again, they suddenly start getting angina again. And so that's what happens. And so then my brother-in-law, Rip Esselstyn, Caldwell's son, has a program that he calls Plant Strong. It's a little looser, if you will. It's for people whose numbers are all in safe areas. Their cholesterol's good. And he says, you can add a little bit of nuts for maybe a dressing, a little bit on some cereal. You can eat avocados, a quarter or a half of an avocado on a bowl is going to be okay. But again, that's Plant Strong. So I think that's really important to delineate that difference in the way that Dr. Esselstyn's working with people who are really sick, who in many cases have been sent home by their doctors to get their affairs in order, and they have to be super strict. So that kind of helps, hopefully will help you understand that a little bit better. Yeah.
I have nothing but great admiration and respect for my friend, Michael Greger, for Dean Ornish, and multiple others who are in this field. But we are more than delighted to match our results, and especially with the angiograms showing reversal and other programs as that we have showing disease reversal. That's going to happen most consistently when we play hardball.
Yeah, it's also a problem for me with toothpaste and fluoride. So I did try not having fluoride for a while, and then kind of gave up because I thought, well, it's 6 of one, half a dozen of the other. Either you're going to get holes in your teeth or
well, you can no. We haven't said don't brush your teeth. Use a toothpaste that just doesn't have fluoride, and be sure you floss. Because the only reason you're going to get cavities is because if you leave food in between your teeth, it sits there and cultivates that bacteria. And if you're careful about with a little brushing through those, and you can get these little brushes that actually go right between your teeth, then you can prevent the cavities from forming. But I'd much rather you have a single cavity than to have a heart attack.
Thank you.
I make a quick comment on the fluoride, Caldwell. I've got my wife sitting here, who's a whole food plant-based dentist, and she's jumping up and down, saying, not agreeing with what you're saying, but making the point that it's the sugar in our diets that is the underlying cause of all of the tooth decay that we have. And the lovely thing when you eat whole food plant-based nutrition, especially the sort that you're talking about, is that risk drops right down because those free sugars aren't there anymore. And your need for fluoride, which has been stuck in water to help compensate for all the poor nutrition that we have, that actually tends to go away. So if you follow it properly, the need for the fluoride disappears.
Excellent.
Thank you.
Yeah.
Can we have one more question from here? We've got to clear our room soon, but feel free everyone else to continue as long as Dr. Esselstyn and team can stay. Just a question, as a doctor, there's a few doctors I can see online here in Australia and in New Zealand, and similar for a lot of my friends here, sitting is around other diets. You get the person come in the door. They are bombarded with other messages. I think the low carbohydrate diet has the best marketing at the moment, unfortunately. Unfortunately. And I don't like to poo-poo these diets. I like to look into, open-minded into the pros and cons of them. And obviously, some of the good things about them are they avoid processed and refined food, which is a big part of the problem, whether they're plant-based or not. And that's where the whole of whole food plant-based is so essential, because there's a lot of refined plant foods that can come into it. But just your take on low carbohydrate and other diets, because that's probably the most common thing I see, question I get as a doctor working in this area. I think there are some benefits to it because you're getting rid of a lot of rubbish out of your diet, but obviously there's lots of concerning foods that you might be eating. And for some people, the best I can shift them to is a Mediterranean type diet, which often can mean lots of things, as we know from Neil Barnard's talks, but it is high in plants at least. So yeah, just your response to the evidence such that it is for low carbohydrate or other diets.
Yeah. What are the major foods? What are the major foods that you think they're eating on a low carbohydrate diet?
That's right. They'll be eating lots of. Well, potentially there are different varieties of it. You may be high saturated fat. You may be low. You can be a low saturated fat, low carbohydrate diet. You tend to then be higher in different sorts of protein, and you can be obviously eco low carb diet and have a more plant-based low carb type of diet, even with whole foods, the Eco Atkins or something like that. But yeah, I'd like to hear your thoughts on it, please.
Well, I guess I keep waiting to see the study where patients who are seriously ill with heart disease are given low carbohydrate diets, and I haven't seen that study yet. And I'm very hesitant, especially when the animal protein begins to go up. That's of course pretty dangerous.
We really haven't seen. We haven't seen the results of long-term high protein diets. Well, I guess we have. You take a look at the Inuit, you can take a look at certain tribes in Africa, and they tend to be, especially like the Inuit, are riddled with osteoporosis.
Oh, look at the Maasai. It was interesting. George Mann was back in the, I guess it was in the mid 1970s, was so convinced that if you were eating protein that was grass-fed, that you would be protected from having heart disease, atherosclerosis. So he marshaled his resources together and went over to Africa. And they went amongst the Maasai, and they were able to autopsy 50 of the Maasai, and they're filled with cardiovascular disease. They're thriving on meat and blood and milk.
Yeah. All right, Martin, should we wrap it up, and we'll see you guys in a month, I think, right?
Look, thanks very much, both of you. Look, it's been an awesome talk. I think it is time to wrap it up. We're approaching 2:30. I don't know what time it is for you, but you're probably wanting to get some sleep. And we're scheduled to meet again in 2 months, I think.
That's right, 2 months. Yep.
Yeah. So the next talk in this wonderful series. So really looking forward to it. And I'd like to thank you so much for the information provided today. The way it's set out is a lovely story. It's crystal clear. I wish medical students were listening to that, because they'd have a great grasp of the pathophysiology of heart disease as a result, and they'd also know how to treat the blasted thing. So thank you.
Thank you, Martin. My pleasure.
All right, everybody. We'll see you in a couple months.
Yep.
Reach out if you need us.
Thank you. Lots of love from New Zealand.
All right. Thanks.
Bye.
Bye.